What are the biggest DME coverage hurdles for life-changing equipment? Imagine needing a wheelchair or a specialized breathing device and facing a maze of rules and delays just to get it. That's what many people with disabilities go through. Understanding the barriers can help you find solutions. Durable medical equipment, which includes items like walkers, wheelchairs, and complex devices like customized power wheelchairs, often has tricky coverage rules. How equipment is classified makes a big difference. For example, simple devices like crutches are usually straightforward, but complex rehabilitation technology devices are more specialized. These custom devices are built to fit an individual's needs, which makes insurance companies scrutinize them more. They may require detailed documentation and sometimes face delays or denials. Coverage varies a lot depending on your insurance. Medicare, Medicaid, and private insurance all have different rules. Medicare might not cover certain assistive devices like grab bars or home elevators if they are seen as convenience rather than medically necessary. Medicaid coverage depends on your state, so access can change from one place to another. When Medicaid renewals happen, some people get disenrolled temporarily, which can leave them without needed equipment for a while. Another big issue is the administrative process. For people who qualify for both Medicare and Medicaid, called dual eligibles, suppliers often hesitate to provide equipment. This is because Medicare may approve or deny claims after delivery, but if Medicare denies payment, suppliers can't bill the patient directly. This uncertainty makes suppliers cautious and can cause delays in getting equipment. Prior authorization is another hurdle. Some insurance plans requiring approval before they will pay for the equipment. While Medicare usually does not ask for prior approval upfront, it can deny claims after the fact. This can leave people waiting for weeks or even months for approval or without their equipment during that time. Even when coverage is approved, costs can still be a problem. Co-payments, deductibles, and limits on how many devices or what types of equipment are covered can make it hard to get the most appropriate or advanced devices. Sometimes, the insurance will only cover basic models, forcing individuals to pay out of pocket for better options. Many healthcare facilities lack clear standards for accessible equipment. This means some providers might not have the right equipment available or may not understand how important accessibility is. This can lead to disparities, especially for those who need specialized devices. Social and economic barriers also play a role. Lack of information, difficulty communicating with providers, and financial hardship can all make it harder to obtain and keep the equipment that can change a person's life. To navigate these hurdles, it helps to know your insurance policies well. Asking questions and advocating for your needs can make a difference. Reaching out to disability advocacy groups or case managers can provide support. Be aware that during insurance transitions, coverage gaps can happen, especially for dual eligibles. Overall, the main challenges are inconsistent definitions of what qualifies as durable medical equipment, complicated administrative processes, payment uncertainties, delays, costs, and standards for accessible equipment. These factors can make it tough for people to get the devices they need for independence and good health.